Of the coronavirus increase, it is important to be well prepared in the event that you suspect that you or a family member has been infected. Here now is NTV's Zainab Ismail with the steps that you need to take.
Right, so first of all, you need to know the symptoms can range from mild illnesses like coughs and headaches to severe ones like pneumonia and kidney failure, and some people will recover easily while others may get very sick very quickly. So what are the symptoms of the virus? Fever, a dry cough, tiredness or exhaustion, headache and shortness of breath. So once you exhibit these symptoms, you need to call the COVID-19 hotline number or these emergency team numbers that were provided by the Ministry of Health even before you visit the nearest health facility.
We are also making a special appeal for members of the public to utilize the toll-free number 719. I cannot tell you how many people have called me personally to report a patient in Huruma, the other one in Mukurweine, the other one in elsewhere. So please, we have a toll-free number. Let's use it.
Calling these before going to a health facility and telling them you have or may have COVID-19 is very vital. This will help protect patients and others in the medical facility. The Ministry of Health hotline or your doctor may advise you to stay put as they come for you. Here is what you need to do next. Stay at home. People who are mildly ill with the virus are able to recover at home. Do not leave unless advised accordingly by a doctor, and do not visit public areas. Wear a mask if you're in the presence of others at home or in a room or vehicle. Monitor your symptoms such as temperature and difficulties in breathing. Cover your coughs and sneezes and dispose of used tissues in a lined bin. Wash your hands immediately with soap and clean water for at least 20 seconds or sanitize your hands with an alcohol-based hand sanitizer. Avoid public areas and public transportation such as matatus and taxis. Just try to seclude yourself as much as you can. Also, avoid sharing personal household items such as dishes, towels or beddings, even makeup with other people in your home. So once you've done this, depending on your symptoms, your doctor or the healthcare provider will tell you if you should be tested or not. They will arrange the test for you in collaboration with the Ministry of Health officials. The doctor will determine the need for a test based on a certain criteria, like if you had traveled overseas in the past 14 days. And it might take a few days or hours before you get your results, and depending on the severity of your symptoms, you may be kept in an isolation ward at the hospital. If the doctor allows you to go home, you should self-quarantine and not go to any public space and follow the steps I told you about. Unfortunately, there is no treatment or vaccine for the COVID-19, but doctors can treat most symptoms such as fever and headaches. Antibiotics also do not work on viruses. So employ these good hygiene methods and social distancing to prevent the virus from spreading.